Good morning. My name is Tembi Somamba, and today we'll be talking about congestive heart failure. Congestive heart failure basically is the inability of the heart to pump enough blood to meet the needs of the body. The heart is a muscle and is supposed to be elastic. So when it's elastic, it relaxes so the blood can trickle in, then it contracts so that blood can go out. So what happens is in congestive heart failure, the word congestive, when you think about congestion, nasal congestion, that's basically accumulation of fluid. This is exactly what happens here because what happens in congestive heart failure is when the heart isn't able to pump enough blood, then blood tends to back up in the blood vessels. So, what causes this? Anything that causes any damage to the heart muscle can be infection. You can have congenital heart disease. You can have actually a heart attack itself, where the muscle cells are dying, so they can affect the contractility of the heart itself, and then or any disease that can cause damage to the heart muscle. So also we can describe it in we can actually define it in two ways. Since the heart pumps blood on the left side towards the body through the aorta and then comes back in the body to the vena cava on the right side, then pumps blood to the lungs and comes back into the heart on the left side, having left on the right side, then we can actually, if you have two descriptions of congestive heart failure, it can be left-sided or right-sided. So your heart will always try to compensate for any damage. So when there's damage, your ventricles or the chambers within the heart try to remodel, trying to compensate for the issues. So if you have left-sided heart failure, so the left-sided congestive heart failure results into respiratory problems because remember, from the lungs, when the blood is oxygenated and wants to go back into the heart, and then it finds that the heart is malfunctioning, then it backs up into the lungs themselves, and that causes the issues because now there's more fluid in or more blood, then more blood into the lung capillaries that leads to fluid that seeps into the tissues, causing your respiratory problems, your coughing, your chest pain, your crackles when you're breathing. It causes shortness of breath. And then on the right side, what tends to happen because it's blood coming back from the organs, then whatever organ is affected becomes basically it swells up because whatever happens in the lungs in terms of the fluid will happen in other organs. So then you tend to find that your organs are inflamed or swelling. There's swelling of the lower extremities, a swelling of the liver, swelling of the spleen, swelling of the abdominal cavity in terms of ascites, and then it causes fluid retention, which you might have weight gain. So, what could be the treatment now? Because things like hypertension also affect your heart, which is or atherosclerosis, which is the narrowing of the blood vessels. So we need to first treat those conditions first, like hypertension or any other disease that results into damage of the heart. We treat that first, and then we then now treat the symptoms, which is someone is unable to breathe, we sit them upright because you want the lungs to expand, and then we also use medications such as nitroglycerin that help the heart to vasodilate, or it vasodilates the coronary artery that feeds the heart itself, and then it also lessens the demand on the heart. So basically, congestive heart failure is the inability of the heart to pump blood. Can be left-sided, right-sided. Left-sided can be respiratory issues. Right-sided can be any systemic issues in terms of the other organs, your spleen, your liver, and also the treatment is basically treating the symptoms. If someone can't breathe, then you can give them O2, you can sit them upright, you can treat the primary cause, which can be hypertension, and also you can give them medications, nitroglycerin, to help the heart pump and require less demands. Thank you.